Well, hello everyone. Welcome to Digital Health News and our flagship podcast where we dive deep into the world of healthcare innovation. Today, we are thrilled to have Mr. Prem Antony, the Chief Digital Officer at St. John's Institute of Health Sciences, join us on this episode. With over 2 decades of experience in digital transformation across industries, Mr. Prem brings a wealth of knowledge to the table. St. John's Institute of Health Sciences is one of the early healthcare providers in Bengaluru and has been imparting excellent care since 1975. Under Mr. Prem's leadership, the hospital is at the forefront of digital innovation, focused on improving patient experiences and outcomes. Let's hear from Mr. Prem about his journey, the exciting projects that are underway at St. John's Hospital, and the future of healthcare in the digital age. Thank you so much, sir. Thank you so much for joining us today.
So that was a very nice introduction, Aarti. Thank you so much, and it is nice to be part of this podcast as well. Okay, so if I may say, I think digital health news have been making a lot of rounds in terms of creating awareness on the healthcare tech across India. So I believe you have amazed a lot of knowledge base in the last 1 year. So congratulations and keep up the good work.
Thank you. Thank you so much for the kind words, sir. Let's move on to my first question to you. St. John's has a long-standing legacy in healthcare. What prompted the hospital to initiate its digital transformation, and what were the key focus areas when you started this journey?
Okay, so before I start, why we went ahead with the digital transformation, so I want to give you a little background. So our medical college hospital celebrated the Diamond Jubilee last year, so which is they are 60 years old, and this year the medical college hospital is celebrating Golden Jubilee. So we are crossing 50 years.
That's fantastic.
Okay. So St. John's National Academy of Health Sciences, the institution is built on 3 principles: integrity, compassion, and excellence. And our aim is to serve the underserved population. Okay, this is about our vision is about bringing quality healthcare to all. Right. So now, if you ask me, so why did we venture out into digital transformation? So I could give you a business context answer saying that, okay, healthcare landscape has changed. Then we have a lot of these for-profit hospitals setting shop, right? And we also have a diminishing trend of the non-profit hospitals in India and all that. But the fact is, we being one of the respectable institution in India, our digital transformation journey basically is to enable, okay, the the patient life cycle value digitally to our patients. Okay, so that's something that we wanted to. That's the reason we wanted to proceed with our digital transformation. Okay, then our digital vision is basically to integrate our time-bound practices with tech to ensure the quality of care remains the same as it was earlier. And going back to the second part of the question on the focus areas, right?
Yes.
So I would basically divide that into 2 regions. One is the front office, which I call it as patient experience. The second is the back office, which I call it as employee experience. From a patient experience standpoint, there are 4 pillars that we wanted to improve on. Okay, the first one is accessibility to healthcare digitally. So it's all about how we can improve the digital access to patients. The second pillar is how do we improve the pre and post visit experience of the patient. The third part is how do we keep the patient engaged, right? How do we improve on those areas? And the last part is how do we handle the unmet needs of the patient? So if you look at St. John's, right, so patient, they don't book appointments and come. Most of them, they don't. They just walk in, right? So there are patients who travel about 200 plus kilometers to visit the hospital. If the patient lands at the hospitals and if the doctor is not there, or if there is no appointment for certain services, then the patient has to go back. So we wanted to look into all these areas. So these are the four key areas that kind of impacts the patient experience that we want to deal with digitally. The second part, the second region that I'm going to talk about is on the employee experience. Two things, two articles. One is on the availability of resources. How do I ensure there is optimal availability of resources? When I say resources, it means the human resources, it means materials, it means equipments, and so on. How do we optimize all these things and make it available at the time of need? Right. That is, and this last pillar that I'm going to talk about is the finances.
Right.
How do we manage our finances efficiently? How do we monitor our revenue? How do we monitor our expenses? And this helps us in keeping the cost at a very economical scale so that we deliver the quality healthcare at that cost. So these are the six key areas that we focused when we started digital transformation.
So, whenever you start off a digital transformation journey, you don't only look at the clinical part of it, you also have to look at the business and management and the patient part of it.
Absolutely, yes.
So, my second question to you is, given the hospital size and the long history, you just said that the hospital completed its Diamond Jubilee last year, 60 years of operation. It has a long history of imparting excellent care. How did you manage the integration of new digital systems with the legacy systems? And what were some of the technical and operational hurdles that you faced in this journey?
Okay. So before I talk about it, I want to give you a perspective of how large St. John's is, right? So we are a 1,700 bed hospital, okay, and we see about 2,500 to 3,000 patients on a daily basis across 70 plus departments or specialties. And we have a good occupancy rate, and we also see a floating population of about 10,000 moving across our 150-acre campus. Given that kind of patient demand, and with that complementing with the diverse mix of software that we have, the modern systems, the SAPs, and also the legacy systems, which basically are built by these boutique software companies. You know, these are built to suit applications, right? So these are rigid applications, per se. So integration was a challenge, yes. And on top of that, you know, when we go live, so what the problems that we saw is there were certain disruptions in the process, right? So we need to handle those operational disturbances or disruptions, right? So for which required main focus on the change management for the staff to to ensure the care continuity is maintained. Okay, but on the technical front, like any organization would go through, like when two softwares talk to each other, you have the interoperability problems that we have to deal with that technically. And the second is the data standardization, and also I would say the migration will take some time.
Data, yes.
Yeah. So these two challenges, and apart from that, you have those security and compliance challenges as well. So we had to deal with all these things to ensure we have a smooth transition. Right. So, and we have learned a lot of things when we are navigating through all these hurdles, right? And what I would say is 2 years and on, it has been a very amazing journey, and we have learned a lot. What to do, what not to do. There were successes, there were failures, and wherever there is failures, we look back and see how we can correct things, and we are working towards that.
You just mentioned about change management, and this is one of my favorite questions to ask all the CIOs that come on the podcast. Well, transitioning a 60-year-old hospital to digital systems is no small feat. Kudos to you for that. What were the biggest challenges in terms of infrastructure, in terms of change management, or resistance to change from the staff and the patients, and how did you overcome that?
Okay. So I have to kind of structure it a little bit for you. So I remember a quote actually from Robin Sharma, which says, change is hard at first. Okay, then he also says it's messy in the middle and gorgeous at the end, right? So if I want to put it across very, I would say candidly, so we are yet to reach the end, but changes are happening. And see, one is being a 60 plus year old organization, and we have a lot of people in the system for a very long time, for 2 decades, 3 decades, and so on. So the process that is here becomes a habit. Okay. So changing that is going to take some time. So you need to convince people, or you need to listen to them, and so on. And hence the resistance as well. So I would say it is a very good thing, because resistance is very good, because you understand from their perspectives on what they are going through. People will get convinced, people will not get convinced, and somewhere we need to find a middle path. So that's something we are handling. So there were substantial tech, cultural, and operational challenges that we had to deal with. This happens to any organization who goes through a transformation, right? Not only saying. So, infrastructure upgrades, yes. So we have to increase our network coverage, and our ISPs have to be upgraded. Then we have to upgrade a lot of end user systems to manage our new tech that we are implementing, and so on. So that is from the infrastructure side, and we had to make sure people go through a lot of these trainings to understand what we are dealing with. So there were workshops, change management workshops, which we were held by the consultants who are implementing the solutions, and I think that's where we started, and we started good, but we did hit some rough patch, but I think we got through it pretty fast, yeah. And the last thing I would say is on the patient experience, right? So this is where we had a lot of support from our operations team. So, for example, we took some time to get our patient portal live, and until such time, we had to give the patients a physical copy of the reports, or our operations team, they were sending it through emails as well. So we had the support of our entire organization, from the management to the different departments, and along with a lot of advisory and consultant stakeholders, so which kind of made possible for all these things to happen. Yeah.
Right. The whole purpose of digital transformation is also to bring operational efficiency into the day-to-day work of hospital management. So St. John's now has a full-fledged IT department. How has
Yes.
this transformed patient care and operational efficiency within the hospital? And could you share any measurable outcomes, any instances where you could, possibly see it live?
Okay, so in St. John's, we don't call ourselves IT. So the name is Transition to Digital Center for Healthcare, or in short, it is called DICE.
DICE.
Okay, so that's for short form for Digital Center. So I do have a very lean team, and our HIS team is a combination of people who are there for a decade or a couple of decades, plus we have some young blood. So which I would say we have a mixture of people with wisdom and agility. And our SAP team is relatively new, so it's newly formed, and our network and infrastructure team, and these guys are a very rare find, I would say, and very proactive guys to make sure our environment is up and running. Okay. Now, what are the changes? What is the direct impact that we have in our operational efficiency and patient experience? The first thing that we did was, since we have upgraded our network infrastructure, so we were able to provide Wi-Fi access to patients. Okay. So typically, Koramangala, once you get inside the building, you will have, you will not have ample mobile network coverage to use internet, right? So we found the problem. So we had given Wi-Fi access to patients for making UPI payments, and also doing self-registration using our portal, and plus only two book cabs like Ola and Uber. So we had restricted the usage along these lines, and we give them access to use our Wi-Fi for these use cases. So this was well received by the patients, and we see a traction of about 500, 600 patients logging to our Wi-Fi on a daily basis. Yeah, this is one of the comforting things that happened. I would say a quick win. The second is we have introduced kiosks for patient self-registration as well as ABA registration. So now instead of paper, people are using systems to enter their demographics. And what we see here is when you write on paper and when it gets typed onto the system, there are errors. Now, since the patient themselves or patient attendant themselves are filling it, so we see a lot of reduction in those errors. And again, this is a quick win. And our PR and PO, the purchase requisitions and purchase order workflows earlier, which we were in paper, and those we have transitioned to a workflow system, a digital workflow system, and our leave applications as well. Yes. So apart from that, we also so we did invest time in understanding, the business analytics or business intelligence using Power BI and so on. So we are able to create comprehensive dashboards using our hospital information system and also our ERP.
Right.
So these are, I think, I would say the quick wins or the operational benefits that we have seen over a period of time, and still more to come. So we have just started. We are just about 1 year, 8 months down the line. I think we should be in a good position by end of next year.
One last question to you. Looking forward, what are the next steps in St. John's digital transformation journey? I believe you also have a new hospital coming up on Kanakpura Road. Are there any upcoming technologies or innovations that you are envisioning to further improve patient care and hospital operations?
Okay, so let me start with this. I'll give you a perspective of how we are growing as a hospital, right? So there were a lot of milestones which we achieved last year from a hospital standpoint. So one is the introduction of a new department called nuclear medicine. Okay, and they are equipped with two sophisticated PET and SPECT scan equipments. And we are one of the one of the few hospitals in Bangalore to have that tech. And we have also introduced robotic surgery here in the main hospital. So again, we are the few hospitals to have that as well. So we are true to our vision of bringing quality healthcare to everyone, right? So that's our vision, and that's where we are heading. In addition to that, we are starting our operations at Kanakpura on 4th of November with OPD. And we are also planning to open another center inside our premises. This is for geriatric or elderly care. Okay. So Kanakpura, and here we are envisioning to go completely paperless. So we want to ensure every body and every systems are on the digital platform, removing the paper option of it. Yeah. So coming to the second part, what I envision as a digital journey from here on, I could reflect back on the NVIDIA AI Summit I attended a week back. I had visited the stall, a lot of promising products that I have seen. So I was busy thinking how we can kind of plug it in, right? The key challenges that I'm looking at today that may prevent me from doing all that is most of the HIS we have today, right, across India, which is kind of made by the boutique software companies. So these are monolithic platforms, right? So if I want to plug in an AI, then obviously I would need applications which are on microservices architecture, and we need to have a separate data model and a data lake to facilitate all that. So it is going to be a significant investment, and also it is. I think we may see a lot of players pitching in this area, right? And the use case for it is what I'm envisioning now today is I want a patient to walk in. He walks to a kiosk. Then on the kiosk, the camera scans his face and it recognizes the patient demographics and he says, okay, fine. You good evening or good morning or whatever. So it says, you have come to this hospital previously and you have seen this doctor. Do you want me to block the appointment again? Right? Or do you want to have a appointment with a different doctor? So he uses the kiosk. He makes the payment. Then the camera on the tablet scans the face. So using a camera, you can track a lot of vitals, right? You can capture
Right.
blood pressure, you can capture heart rate, you can capture, what is your sugar levels also. A lot of things, lot of these clinical parameters we can capture. So it takes a snapshot of his vitals, then it generates a token number or it sends a message of what time he can meet the doctor, and patient walks out. So by thinking all these things, what I feel that we might not have a counter for billing in future, right? So we need to look at technologies which can enable these things to happen.
Right.
So this is one such idea. I think there's a lot of scope for these software companies to kind of build products in these areas. And I think for St. John's, I think we also should venture into such technology to give a good patient experience, right? So, and I would call that as 4 KPIs. Right? So when I say KPIs, it is not key performance indicators. So the first one stands for keeping patient informed about appointments, informed about availability of doctor, informed about a lot of payments and all those stuff, right? And second is keeping patient involved. So it could be like AI helping them out on sending notifications. Have you taken the tablet? Yes. If you consume the tablet, you punch in yes. So keeping the patient involved so that you have a follow up, whether to replenish your medicines or to block another appointment. Right. That is the second KPI. So the third KPI is keeping patient interested. Right? So how do you keep the patient interested? So by passing a lot of, I would say, tips on healthcare, okay, and also keeping them interested on the number of steps they take on a daily basis, connecting to their gadgets and
Variables.
so on.
Yes.
Variables, and you can also publish a leaderboard. Okay,
That's
so
an
you will be
interesting way.
competing. Yeah,
Definitely.
it's a very interesting way. If you keep the patient involved, interested, and I would say informed, then finally the patient will also be invested in the hospital, right?
Absolutely.
So by using AI, I think there's a lot of possibilities. So only time will tell how much we can leverage on AI to make sure we have provided an impressive patient care. Yeah.
Yeah. Thank you. Thank you so much for all this detailed information. I think the mantra of 4 KPIs was definitely the key takeaway from this interview for me. And all the best for your ambitious endeavors, your future plans for St. John's. Thank you so much for being part of this conversation.
Thank you, Avati. Yeah. Have a great day. Yeah.